This is the second session of the Girls to Industry Summer Program. Thank you to everyone who has showed up today. Last week we had Dr. Bhavna Joyce, and it was very exciting to see her and talk to her about her experience working for the pharmaceutical company, which is Alnylam Pharmaceuticals. And this week we are speaking with Amy, who is an intern at Galderma and also a current pharmacy student. So it's very exciting to see how she's using her pharmacy degree to do great things at this up-and-coming pharmaceutical company that is focused on skincare. And something that different that we're doing this session is, unlike last session where we read your questions to our presenter, this time you'll actually be able to read your own questions whenever your question does come up. And you can definitely keep your video off throughout the whole time, as it does refrain from any distractions. And whenever your question does come into queue, you're welcome to turn off your video and your sound as you can turn on your sound at that time and then ask your question, or you can just let us ask the question if you don't feel comfortable. And this will be recorded and sent out to all of the participants. And there will be a post-session survey just to see, whether or not you watched the video or you participated in the live session. All right, so just like last time, we will be meeting with the speaker for today, and then you are welcome to ask any questions at the end out loud. Or you can just ask them in the chat and then we can ask the presenter, and then of course complete the post-meeting survey. And just so we refrain from any distractions, you may keep your video and sound off. And please, no spamming in the chat area. We are all trying to be very respectful towards one another. And before I turn it off to our speaker for today, our speaker is Amy Ackershoek, who is the current pharmacy student and is a Cetaphil innovation intern at Galderma. She's also an MBA student, and she has background in science communications and brand marketing. So I will now turn it off to Amy. Amy, are you there?
Yes, I'm just going to share my screen. Thank you. Like that. Okay, does that look good?
Yes, that does look good. And can I get a thumbs up from the audience to see if you can also see it as well? Okay, so Ria said yes. Okay, so it seems like the audience can see your screen, Amy.
Okay, perfect. Thank you so much. And thank you, everyone. I'm so excited to be speaking with you today. So my name is Amy Ackershoek. I'm a current pharmacy student. So I went to high school in New Jersey. It was in my school's medical and science club, as well as honor society. And I knew during that time that I was really interested in pursuing going to pharmacy school. So I had that plan in high school, and I started off going to High Point University, which is in North Carolina. And my plan was to go there for their 6-year pharmacy school. But after my first year, I realized that that wasn't the right fit for me. So I decided to transfer to a community college after my freshman year. And this helped with the affordability of pharmacy school, as well as allowing me to be closer home to my family. So I went to community college, and I took advantage of taking a lot of virtual classes and completing my pharmacy prerequisites, since I still knew I wanted to go to pharmacy school. So from fall of 2016 to the summer of 2017, I was able to do 2 years of college in 1 year. So that really helped me a lot with being able to pursue my pharmacy degree, as well as helped me I never had the plans, since for pharmacy school, you don't need to have a bachelor's degree, but I knew that that was something I wanted to pursue in case I didn't get into pharmacy school right away or changed my mind. So I transferred to College of Charleston, where I was able to get my bachelor's degree in psychology, and I graduated in 2018 from College of Charleston. And then this is kind of just showing my educational background. So I'm currently at the Medical University of South Carolina, And then I'm also pursuing my MBA, so I'll graduate next May with both of those. And then at College of Charleston, I was involved in their CFC Leadership Club as well as sorority, and I got my Bachelor's of Science in Psychology. So while in pharmacy school at MUSC, I was really interested my first year in looking at careers in industry. So we had a project. Our advisor, she was working as a medical science liaison and at Allergan, so working with like aesthetics, so not really pharmacy related, but working with the more aesthetics and Botox and that kind of side of it. So she kind of introduced me to industry, and that kind of helped spark my interest. So I started doing the Value of Pharmacy Case Industry competition, which was an elective. So I did that in my P1, P2, and P3 years, and I started on the medical affairs team. And then my P1 year, I decided, you know what, I really love the industry pharmacist organization. So I decided to run for president-elect and then was president last year. So last year I helped with marketing strategies since like a lot of pharmacy schools, they're very hospital or residency focused. So I decided to kind of help and come up with different ways to attract other students who maybe want to pursue a residency but are interested in learning about industry to kind of help them join our industry organization and help us grow. So that was really successful, and we helped grow our chapter by about 35% last year, which was great. And then I also, as president-elect, I served as the director of national engagement, so just helping attract new members and coming up with marketing strategies when having new students come in or who are interested in learning about IPHO. And then my school has a Phi Lambda Sigma Leadership Society, so this was something you're nominated for. So I served as treasurer, and I helped with the financial transactions, and then we also the exec board organized this last year. And then, so kind of how I got my start with my internships was COVID happened and my hospital internship last summer was canceled. So I'm not the type of person who could sit home and not do something. So I started applying to internships, and just the internship at One Skin just came up and I applied to it. And this was, they were originally looking for a graphic designer. So this was definitely not anything to do with pharmacy, but I reached out, and since I was really interested in the company and their mission, which is focused on like health and longevity, and they're not an anti-aging company, they're really promoting aging, but like living a longer and healthier life, which is definitely something that I was passionate about. So I reached out to the recruiter for it, and I just wanted to know if they had an internship coming available or if there was any way that I could get involved. So I reached out and kind of was like, I'm a pharmacy student. I know you're doing all this very complex science stuff. And could there maybe be a need of me helping to explain like the science side to your consumers, since it's a direct to consumer brand? They only sell it on their websites, not being sold in stores or anything like that. And we kind of came up with the idea that I could help with writing Instagram captions and blog posts, since that was kind of her responsibility. So it helped alleviate her responsibility and allowed me to just learn so much about science communications, marketing, helping with product launch, direct to consumer brand, which is an amazing experience and really kind of helped me get my position now by giving me the prior experience that like if I didn't have this internship, I wouldn't have had the experience to talk about all this stuff that I've done, since what I'm interested in isn't really something you kind of learn or do in pharmacy school or their rotations. It's kind of more unique. So this was just an amazing opportunity, and it happened just because my hospital rotation got canceled. So it was just one of those things that came out of the blue, but was amazing. And it really helped me give a lot of credibility to what I speak about in interviews now. And kind of really, I have blog posts I've written, captions I've written, scientific articles I kind of help them find. So have a portfolio of like what work I've done for this company, which was really helpful. So now I'm currently working at Galderma. So this kind of came about because I knew I wanted to gain more experience in the pharmaceutical industry, and we do pharmacy school rotations, but I knew that I wasn't able to, having the internship was kind of more the experience I was looking for. So this was a 16-week internship this summer. So I'm kind of going to explain it. So I work as a Cetaphil innovation intern. So what I'm doing is really helping with the new products that are going to be coming out next year. So if you think about having like an anti-aging cream that's the company is going to come out with, first you have to come up with the competitors. So maybe there's Neutrogena has an anti-aging cream or CeraVe has an anti-aging cream. So we're first looking at the competitors and what products they have and what claims they're making. So are they saying it reduces wrinkles by maybe 25%? Is it helping skin be more elastic? Is it helping the skin barrier be stronger? Looking at what claims these other companies are coming out with and what products are successful in selling. So first we do comparative research, pull the claims. You're looking at like websites like such as Target, Ulta, the company's websites, and pulling what claims they're saying about their products. So we put that in an Excel sheet and then we come up with claims that are on that list, but also what claims do we want our products to have that are kind of different. So this is just a total example, but if we are having an anti-aging cream, maybe if a company says that it reduces wrinkles by 25%, we would say 50%, and that would be done in clinical studies and could be proven on that. So after you do that, it has to go through medical, regulatory, legal. So there's a lot of meetings and changing the wordings of it. And then all this information gets sent to a company that does consumer research. They have consumers, they rank what claims they think are important, they rank what names they think are the best, they rank what products they would be more likely to buy and influence on that. So we get all this information, then we have to figure out, okay, this is the name, we're going to go with the product, and then look at the top claims for that. And then when you're looking at the top claims on the list, that's figuring out what product names are going to go on the front, that when people are see your product in the store, this is what they're going to want to purchase the product for because it says it reduces wrinkles better than the leading competitor or something along those lines. So that's kind of the direction that we go with it. And then there's the labels on the back if it comes in a carton. So there's a lot of work that I had no idea that goes so much goes into it, so many meetings and discussions over little details of exactly what's on the package, which has been really interesting to see. And then as well as what ingredients. So maybe we pick an ingredient that we thought was going to work and it doesn't come up with the same results that we want. So we have to come up with a different ingredient and have the researchers test that. So it's been really interesting to learn that. And I think having my pharmacy and MBA degree has really helped a lot with my understanding and just being very good at the communication skills and knowing exactly what people are expecting of me and what work like and following up with people and what other stuff needs to get done to kind of help the project stay on timeline. So I found that to be an amazing experience at Galderma, and it's a great company. If you guys ever have the opportunity or see it for an internships, it's very focused on helping students. So they have a huge internship program. So we have weekly check-in meetings. My boss is amazing, and I've spoken to several other people who have bosses there, and they're just it's a very good company to work for, and they also have professional development events, so really helping us. And from my interviews with other companies, it's one of the few companies student hired from their interns. So I thought that was important when I was selecting an internship, that they really are investing in their interns and want to help them succeed in their future careers. And then for my future plans, so I'm a fourth year pharmacy student. I did two rotations, one at homeopathic pharmacy and then one at a DNA testing center this summer. And then I have 7 others to do throughout the fall and next spring. But that kind of introduced me to the functional medicine side of pharmaceutical industry and seeing if maybe I could use my MBA to kind of help fill a need in an area. And I was interested in skincare, health, and longevity from my other experiences. And then for my DNA testing rotation, I was really interested in like the epigenetics and seeing what supplements that can be used to help with that. So those are kind of my interests as of now. But if you asked me a few months ago what my interests were, it would have been totally different. So I'm sure just like you guys, not you don't really know exactly what interests you, you know the area and all, but it's perfectly fine to change your interests since no one really stays in the same career forever, especially in like industry. You can bounce around so many different areas. So, my advice to all of you guys would just be confident in yourself and your education, and just know that what you know is really important, but it's just having the confidence goes a long way. And then don't second guess yourself. You know that what you're capable of, you're going to be successful. And then to just make sure that you could be adaptable. So, initially, my plan to go to pharmacy school at High Point, that didn't go. And at the time, I didn't think that was I thought that was the end of the world, but truthfully, it was probably the best thing because was able to get my bachelor's degree. I was able to go to MUSC, which is in state, save a lot of money. I was able to gain all these other experiences that I probably wouldn't have had if I stayed there. So just be adaptable and know that if something doesn't go the right way, there's probably something better. So I just wanted to also, I made this flyer just for you guys who are interested in applying for internships. Kind of, there's not really a right or wrong way to do it. This is what I did. So I just wanted to kind of share from my experience. And if anyone has any questions about this, so please don't hesitate to either email me or call or text me. I would love to answer any questions you have after at the end of this presentation, but if there's anything that comes up even a few weeks from now, don't hesitate to reach out. But so first I would identify your interest. So this is kind of the most challenging part, but there's so many internships, so figure out what really interests you. So I kind of use this example here is if you like writing and you have a background in science, maybe a medical writing internship might interest you, but really figure out what interests and passions you have, since that'll help you when interviewing for these positions. And then update and revise. So if you don't have a LinkedIn profile, I would highly suggest you make one. That's how I got both of my internships as well as my pharmacy intern job. I've really found it to be super useful. So just make sure you update your headshot, make sure it's professional, have a good introduction, explains who you are and your career goals, and then make any updates to your resume or CV, and then also have a cover letter specific to your position that you're applying for. I think that's very helpful and helps you stand out against the people who don't have a cover letter, kind of giving more information on why they're interested. And then for LinkedIn, so like I said, it's a great resource. You could search by job notifications. I put here remote positions because, as I said before, my other position, they kind of want it to be in California. But I think, especially with COVID and everything now, a lot more companies are looking into remote internships. So definitely try to keep that, since if you're just narrowing it by the certain city you live in, you might not find as many positions. But kind of open your horizons and see what other companies are out there and see if they would consider remote work. And then also be creative with what you're looking up. So don't look up just like the internships and have it filter through those. Look up pharmaceutical internships, undergrad ones, since sometimes it takes a little while for the what you're interested in to kind of show up, and you might see it like a week from now and it was posted a few days ago, or it might have been posted a few weeks ago and you just never saw it just because you weren't searching the right things. And then start small. So my first internship was at a smaller biotech company with like less than 10 people. So I'd really suggest you find a smaller company that's looking for an intern and gain experience that way. And that really helped me get my internship at Galderma now. So I don't think it definitely you could apply to bigger companies, but just try to focus on a smaller company first just to get the experience if you don't have any experience besides just your education. And then also having a smaller internship at a smaller company will help you kind of stand out from other candidates and make you more competitive. And then just keep applying. So I would suggest about 6 to 8 months prior to when you want to intern, start applying. And then I use LinkedIn Premium just so you can message recruiters and HR people. And this, I thought this was very helpful. And that's how I got my first internship, just by messaging the people who are posting the job. And then don't be afraid of rejection or to say no. So not every internship is the right fit for you. Sometimes you won't realize that until after you went through a few interviews and you got offered a position and you kind of second guess it. So if it's not the right fit, you can always say no, and definitely something better will come along the lines. So don't feel like you have to say yes to the first internship you get. And then I just put this here in case you guys know. So some states require pharmacy intern hours, which are completely different than industry internships. So pharmacy intern hours have to be in a pharmacy, and industry internships are just something you do that you're interested in. So you don't have to be on a pharmacy school to do the industry related internships, but for the pharmacy intern hours, that's for pharmacy school. And then this is just my own experience, so it could differ from yours. And then I just included this page just with introduction networking messages, since I feel like that's always the hardest part, is figuring out like what to say and how to not sound like you how to sound confident. So I just included these two, which I use a lot. This is just if I was going to message someone I didn't know on LinkedIn and was interested in their area. And then this is the one I used for when I reached out for my first internship and just wanted to see what they were interested in. So I hope that was helpful to you guys. And like I said, I would love to answer any of your questions. And if you think of something next week, don't hesitate to reach out to me.
Thank you so much, Amy. That
You're
was
welcome.
that was a very beautiful presentation, and I am getting some questions in my private chat. And let's first start with the ones in the private chat, and then I will go to Akila and Stephanie after I have gone through this question. So the private question was, how do you remain confident as a woman in your skill set with men taking over the workforce? And I think it means in terms of working in the pharmaceutical industry, how do you remain confident?
I think it's really just knowing that you have the skills and you have the education and you bring a lot to the table, and to just know that. And it's really your biggest critic is yourself. So to not think that you're any less than anybody else, even if it's someone who's older than you, you have the skills. And if you're offered a position, you were offered it because they saw something in you. So it's really you're the one who's making yourself not be less confident. So you need to kind of change the perspective and be the one who is confident. And I know it is challenging sometimes, but it's really just focused on, okay, you're here, you need to do this, and you have people counting on you. So if you can't kind of do it for yourself, do it for the people who offered you the position, who accepted you into the school. Do it for those people then, if you can't do it for yourself. But you definitely just have to remain confident and know that you were in that position because people believe in you.
Great, thank you so much. Another question that I got was, what were the internships you did? I know that you talked about the internships that you completed. Could you go more into depth into how you got your OneSkin internship, and what were some of the things that prepared you for that internship?
So the one at OneSkin, like I said, it was kind of just I was searching for stuff, and I was applying to real like actual pharmaceutical companies. So last summer I applied to like Appe, Genentech, and I kept getting denied from those positions, and I really didn't know why, because I figured I'm in pharmacy school, I'm getting my MBA, I have all these great skills, but it's just that so many people are applying to these larger companies. So kind of you get lost in all the applicants if you don't have something that really makes you stand out. So I know I applied to several smaller ones that I was thought that I should get, and kind of just was hoping that it was just like the timing was the issue. It wasn't that, because I thought I had good experience. I showed that I was passionate about industry and all. But it was just an internship that came up one day on LinkedIn, and I saw it right away. And I was like, you know what, this is the one I really want, even though they weren't looking for a pharmacy student or anything related to my skills. So, like I said, they were looking for a graphic designer, and I just reached out to the project manager, the girl who was hiring, and I sent her. You could see on that other flyer that the second message, that was exactly what I sent her, and I waited probably like 4 weeks to get a response, and I just like kept following up and following up because I was really interested in that. And if even if they couldn't help me with like an internship, then maybe I could do like one of my pharmacy rotations with them, or just like something was my hope. And so she reached out on LinkedIn. We scheduled a phone call and we just talked, and I explained that I was interested, and she told me more about the company, and we were kind of like brainstorming and came up with that I could help with their blog posts and Instagram captions and be part of like their marketing team. And so, since they need kind of more help with that, so I even it's a smaller company, so a smaller company would love to hire interns because they just don't have the amount of people working for them. It's a smaller company, and there's so much work that could be done that interns easily can help with. So it kind of just the stars aligned and that all worked out. So I was in their marketing meetings, and we just helped with the product launch, and really just helping with the Instagram captions and kind of explaining the product to consumers. And then at the time, like we weren't ready to officially announce what our product was yet. So just doing like the science on health and longevity, looking up articles and coming up with um, interesting information and facts and studies that were kind of just coming out of how we could kind of keep the consumers still interested in like what we were posting, but like not give away what our product was yet.
That sounds so exciting. And, your experience in this pharmaceutical industry, especially in the skincare line, is
Mhm.
definitely a route that a lot of people can look into now that, you've
Mhm.
shared this amazing information. Um, and were these paid internships?
Yes, both of them were paid, and I know. So I've haven't heard of anybody who was in the pharmaceutical industry or like biotech who wasn't getting paid. I know there's certain internships that like would specifically say on LinkedIn like not paid. And even I mean, with my first internship, I was like, even if I'm not gonna get paid, like I want this experience kind of because I was so interested in it. But from after getting the offer and all, I've kind of found that compared to a pharmacy intern job, so like working at like CVS or Walgreens, these internships are kind of paying about like 2 to 3 times more. So it wasn't that I was motivated by the money, but because I was interested in it, pursuing a career. But it's kind of not spoken a lot that a lot of internships pay a lot more, especially a smaller biotech company that they have more, I guess, funds available since they have less people to pay, that they kind of would be interested in hiring interns. So I wasn't specifically looking for paid or unpaid, I was just looking for experience to start, but yes, they do pay, and then it's just really you don't really know how much they're paying until you interview and get an offer, which is kind of the difficult part, so you don't really know, I guess, the average range, but if you can market yourself well and your experience and kind of for me, having the pharmacy degree as well as the MBA is kind of where I try to showcase that this is, I think, what I would be worth. So I know it's difficult when you don't really have the negotiating or like job experience to kind of know how much you should be getting paid. But they were both paid, and I think that it was very well compensated for my education.
Of course. Um, Another question that I got, and Ria, if you want to unmute yourself, you can definitely ask this question, or I can ask it. So, Ria, do you want to ask this question?
Yeah. So my question was, many internships look for undergrads or even graduate students. So how can a high school student have an opportunity to participate in these type of internships?
Okay. Hi, Ria. So my June rotation, she owns a smaller biotech company, and these companies they would be interested in having a school internship if it's not a larger company, maybe like 10 to 15 people if you looked on LinkedIn, and just reach out and explain what route you're interested in pursuing and why you're interested in that. And a lot of people would be interested in having high school students just because you if you have the passion and maybe that they're not really formally advertising that they have an internship, but it's you reaching out seeing if you could start something. And even if you just do it for the summer and maybe that one's not paid, but then next summer you're able to get a undergrad paid internship. So I really encourage you just to reach out and see what companies kind of interest you and just send out, I guess, on LinkedIn or emails and just you'll probably get a lot of no's, but eventually someone's going to have to say yes and be interested and just be appreciative that you took the initiative to reach out to them. Does that make sense?
Yeah, thank you so much.
You're welcome. Good luck.
Thank you, Ria. That was a great question. Another question that I got in the private chat is, what is the most important trait in a potential employee?
I think for me and when I was interviewing, it's just to show that you're passionate and that you're very interested in the company. So it's hard if you're not passionate about it, it's going to be very hard to do the job. And I think that from my interviews that I really showed that I was passionate and interested about whatever I was applying for. And I think that's kind of what helped me get the interviews in the first place, seeing what on my resume that I'm not just someone who's applying who saw this and thought, "Oh, it's cool." No, I'm really interested in that. So if you could show your passion, I think that would really help you stand out to future employees.
No, that's some great advice. Thank you, Amy. Alondra, do you want to unmute yourself and ask your question, or would you prefer that I ask it?
Hi, Amy. So, what's your biggest tip while pursuing a career in medicine? Like, what do you constantly keep in your mind as a motivation or where you find your purpose in medicine?
Mhm. So I got this advice on my first week of pharmacy school from a student who was a year above me, and she told me it's hard, but it's not impossible. So tons of people have done it before you. It's not impossible. You know, it's not. There's tons of pharmacists. There's tons of doctors. People have done it before you. So it's definitely not possible. But when you're in the middle of it, it's very hard and it becomes overwhelming. But if you just kind of keep that in your mind that like it's not impossible. Tons of people have done this before you. It kind of makes you realize that yes, it is hard, but it's not impossible. Don't doubt yourself. So I think that's the best advice and kind of what I've used to kind of motivate me as I go when it's those tough days when you have a lot of tests and you have a lot to do. Other people have done it. It's not impossible. You can do it. I hope that helps.
No, thank you, Alondra. Great question. And thank you, Amy. That was a great answer to that question. Another one that I got in the private chat is, what is the best way to maintain a large and strong network?
So I think it's just really if you're going to use LinkedIn, just reaching out to people in your who live in your area, reaching out to people who have the same similar interests as you, and then also once you have these connections and all, follow up with people. So even like my preceptors who I just had in May and June, I'm going to continue to follow up with them because they're both in careers that I'm interested in. So don't become, if you meet someone, don't become like a stranger to them. Really follow up, be interested in their life, interested in what they're working on, and really just keep building your network kind of like that. And if you build a small, strong network, so maybe you only have 5 to 10 people to start with, and then who do those people know that they can introduce you to? I think that's really where it comes from because I think my strongest network connections that I didn't know personally came from people who were close to me who thought, "Oh, I think you should talk to this person." And then on LinkedIn, if you see people our age who you think are doing maybe a year or two above you, reach out to them and see who that kind of like inspired them and reach out to their network person because it's kind of like the generation. So someone who's just starting their career, someone who's been in their career a while, I think that's really useful to have a network of diverse ages.
Mhm. Great answer. Another question that I got is, how did you skip the year and do 2 years in one? I believe they're talking about your college education.
Yes.
Mhm.
So I am very motivated. So I guess I kind of when I left High Point, I only had like 25, 28 credits. I didn't have a full year's like I dropped 2 of my classes. It just wasn't my year. So I didn't have a full 30 credits when I left my freshman year. So that summer, fall, spring, and then the following summer, I just took tons of online classes and honestly, that's literally was my life for a year. That's all I did. And I knew that I wanted to go to college at Charleston. I knew that I didn't want to have to take the because I knew I was interested in pharmacy school. So all the other classes that weren't pharmacy prerequisites, which were like the 60 other credits, I knew I didn't really want to have to take those unless like I had to graduate. So college at Charleston, I was able to transfer in all 90 of my undergrad credits. So I had about like 25 to 28 from High Point, and then the rest were from community college classes. And so I took advantage of online classes, the hybrid labs where you took the class online, then did the labs in person. And then my community college had different like first 8 week session in the fall, second 8 week session in the fall. So really just taking advantage of how many classes I could fit in then. And then in the summer I did Maymesters, and then it was considered summer 1 and summer 2. So really you just have to be motivated. And I know like when I transferred to community college, they told me like, oh, you should just take one science elective. And I took like physics and chemistry in the first semester and like was taking all these other online college classes. So my advisor, she was like, no, I don't think you should do that. And I was like, no, like I can do this. Like I want to do well and I want to um I know like my end goal was I wanted to transfer into um a regular college and transfer my credits and be able to graduate prior to going to pharmacy school. And honestly, I didn't realize until like the day I had graduation after college Charleston, like, wow, I actually like did that. So it was just a lot, but not impossible.
I don't know, that's a great experience to have. Another follow-up question is, would you say that there's no point in spending lots of money on undergrad? What's your take?
So my first year, my freshman year, I have a loan of probably like $40,000, and then my other community college classes in college at Charleston, I did not spend that much money. I don't really have any loans from that. I used other money that I had set aside for my college fund from my parents and all, and to pay for that. So that was nowhere near $40,000 at all. And then I guess in pharmacy school now, I think our tuition's like 25,000 a year. So from my perspective, like looking back now, it was crazy that I spent so much money on my freshman year. It was a good freshman experience to go away for college, but for housing, the education part of it, that was a little expensive compared to pharmacy school where it's only like $25,000 a year. So I think it really depends on what you're interested in. If you maybe get that freshman year experience and try it and see if it's right for you. But I would suggest if you can take classes in high, my school didn't offer this in New Jersey, but if you could take classes in high school, try to do that. I would take community college classes. I know some colleges are more strict on like what you can transfer in, what you can't transfer in, but I would really try to do that and see. I know you're not thinking about it as if it's better to think about it kind of beforehand and be conscious of the loans. But if you decide to go to medical school, pharmacy school, any of those, you're gonna most likely have loans, and a lot of people have loans, so it's not unheard of, and it's just something that you're gonna have to deal with later. So if you can kind of try to be proactive and take as many classes that aren't as expensive and do it that way, I think that will pay off in the long run. But for me, that's just how it worked out, and it's everyone's own path. But I know some people, if you go in the medical pharmacy route, most people have loans, so it's really just figuring out how much of loans you wanna have, if that helps.
Great advice. Another question is, what are the best elective P4 APPE rotations to take if you're interested in a career in industry pharmacy?
Mhm. So, for industry pharmacy Appe rotation, so some of it depends on your school. So for my school specifically, we're not in, I guess, New Jersey or New York where there's a lot of industry opportunities. So for our industry rotations that our school offers, there's a medical writing Appe rotation, which I'm doing in September. It's called BGB Communications. And then we have Nephron Pharmaceuticals, which is in Columbia, which is offered. It's not a traditional industry rotation kind of, but it is considered an industry. And then there's other things like managed care rotations or medical information, which things that are industry related but not exactly industry. But if you really want industry rotations, we either have a lottery system where you can get an Eli Lilly or Sanofi rotation, but it's just a lottery and kind of random who gets it. And then you can apply to or industry rotations through you apply directly to the FDA, Procter and Gamble, and then in Florida or Texas now they moved. It's like Senda, so they're kind of like a managed care. So those three are application based ones, and I applied to Procter and Gamble, and I have that in February 2022. And I think if your school is like my school and you can kind of reach out and set up your own. So I set up the one at the DNA testing center, and that is considered industry related. And that was just I found someone else who did it on LinkedIn, and I just reached out to the preceptor. And then my main one was a homeopathic one, which wasn't considered industry, it's considered more of a community pharmacy rotation. But it was kind of in my mind, it's kind of like an elective since it was more not focused on like patient care, but like learning actual that supplements and all. So I think the best ones are whatever your interests are, and if you could set up your own through other areas to kind of have your rotation be directly what's related to your interest, I found that to be the most helpful and what made me most excited about my Appe rotations.
Mhm. Yeah, those are some great advice, especially for all of the, third year and fourth year students here who are currently going to pharmacy school. That is some
Mhm.
very good advice. And one last question is, how do you stand out to different pharmaceutical companies?
Mhm. So I think it's really about your personality and what you can bring to the table. So I think as I start applying to jobs and all of that, really just showcasing what I've done in the past. And now that I had worked at OneSkin and now for Cetaphil, I have this kind of portfolio that I can show them of work I've done. And this is I've had experience doing this. I've had experience working with medical and regulatory, and really just showing your past experience. And because I kind of, when I was applying to internships, like I said, for OneSkin, I was kind of annoyed that like I wasn't getting accepted to these bigger companies, but it's really, yes, you have the education, but it's you need the experience to go hand in hand with it. So kind of now as I and finish my pharmacy school and start entering like the workforce, I think it's really just showing what experience you had, and I could talk about my rotations. I think that'll help me stand out.
Those are some very good advice for anyone who is currently in the workforce, and are thinking of bigger and better things or are
Mhm.
just getting in there. Yeah, and those were all of the questions. We can wait a little bit for another question, but I think, you did a great job today, Amy. I loved your answers. They were so thorough. And here is Amy's contact information. She would love to connect with you all on LinkedIn. Like she said, building a network is very, very important. And maintaining this network is also just as important as well. So please be sure to say thank you to Amy after this. And yeah, of course, Kat, Alondra, you all are awesome. And Stephanie actually had a question. Stephanie, do you want to turn on your sound and ask?
Hello?
Yes, we can hear you.
Okay, question, Amy. So I am an incoming P2 student. So I've had a little difficulty like starting internships. Like I work part-time and then also school. So basically our only free time would be like holidays or like breaks or whatever. What would be the appropriate time to look for an internship that's not like assigned from your school or anything like that? Like when would be like the appropriate time?
So if you asked me when I was, if you want to, or during P2 year, like when would I've gotten an internship, I honestly couldn't have told you because my school, we require pharmacy intern hours. So after my P1 year, I started working at a specialty pharmacy, and at the time we needed 500 hours, which was changed to 200 right before COVID and all. But I was overwhelmed with that and knowing I wanted to be involved. And I honestly never thought I was going to apply to an internship. And so the one-at-one skin, since it wasn't with a larger company, since larger company ones typically are like 40 hours a week in the summer, which would impact your rotations and school stuff, my one-at-one skin was only 10 to 15 hours a week. It was mainly on my own time, except we had a one time a week, a 30-minute phone call and just to check in and make sure. But I thought that that was the perfect type of job to do during the school year, and I did it all throughout my P3 year. And if I didn't have time to work during the week, I had the weekends to easily find 10 to 15 hours to get my work done. And I thought that working at One Skin and just something that you could do for 10 to 15 hours a week, kind of if you had to do a pharmacy intern job at a CVS or Walgreens, kind of to replace that, that was the same that everyone else in my class was doing. So it wasn't anything that wasn't manageable. So I know it's hard to find, and I talked to other people in my school who were like looking for that, and they are hard to find things that you could fit in with your school schedule, but really just to look for them and to reach out to people and just keep your eye on LinkedIn, since there maybe there's something that's only 5 to 10 hours a week, but you could do more than that. It's really just finding the right fit for you. So don't say, I wouldn't discourage yourself and say that like you can never do an internship. You definitely can. You just need to find the right company that is looking for the same hours that you want. And it just takes some time of searching and reaching out and seeing what you can find that fits your interest and your schedule.
Yeah, I had that trouble actually with the summer. I was doing an internship with CVS, and I have 8 years of experience in retail, and I'm trying to get out of that. I don't like, not that I don't like retail, it's just I'm trying to expand, like you said, I'm trying to look for other internships or even other jobs so I can work
Yes.
with. But it's really hard because they look at you like, oh, intern, like you're an intern or you're a student. Oh man, you're not going to be able to work, not even part-time, because you're not really able to, you know what I mean? So it's really
Yes.
hard. So that's why I was kind of asking you, but okay.
Send me a
Right.
message after and I'll send you some things that I could find, okay?
Oh man, you're the best. Thanks.
You're welcome.
So that was a terrific answer, Amy. Thank you so much. Akila, did you have a question that you wanted to ask Amy? And you're welcome to turn on your sound, or I can ask it for you if you're fine with that. Okay, I'll just ask her a question. What year did you start your internships, Amy?
So I started my One Skin one that was in, so about like a year from now. So it was after my P2 year, right before my P3 year, so in the summer of then. And when I accepted that one, I wasn't really sure how I was going to manage it during the school year. I was kind of nervous about that, but it wasn't really supposed to go that long, but it was supposed to be about like 6 to 12 weeks, which I figured that would put me right at the beginning of the school year. And that actually, I did that for about like 8 months. So that kind of just happened and it just worked out. And then my current internship, I started that this year, just like on a part-time, just getting used to everything in May. And I'll finish this one up on August 20th.
Great. And that's great that you are perfectly managing your time so that you have that good work-life balance. At this time, it doesn't seem like anyone else is asking any questions. So we will hang back a little while if you want to directly ask Amy any questions. And I see there is another question, I believe from Akila again. She says that she's currently an incoming P1 and she has been looking for an internship. Do you have any tips, as I am frequently underqualified? So do you have any tips for incoming pharmacy students?
Mm-hmm. So I really think I know coming into pharmacy school, it's very overwhelming. So say that you don't end up getting anything right when you start. I think that would be perfectly fine. But if you're speaking that you don't have the qualifications, it's really figuring out what qualifications do you have then, and figuring out kind of how can you use what your education, your classes, and kind of find your own way. So maybe you don't get an interest for, but I said like maybe start small, look at smaller companies and see what they have, because there'll be a lot less people. And maybe if you reach out to someone directly, maybe they're not advertising directly right now for an internship position, but when you say, are you looking for an internship? Maybe they start thinking, well, maybe we could use an intern. So really just searching on LinkedIn, like I said, I know it sounds repetitive, finding companies, finding people in your area, smaller companies, if you're underqualified. I think that was like the biggest thing. And for the OneSkin, besides just having pharmacy school education, I didn't really have any other qualifications besides that I was persistent and just motivated. And I think that speaks volumes. So don't doubt yourself and just keep trying, because I know it's hard, but you'll definitely find something.
Mm-hmm. Great advice and great question, by the way, since a lot of students are incoming pharmacy students and or college students. Another question is, what high school did you go to in New Jersey?
I went to DePaul Catholic in Wayne, New Jersey. That was my high school.
Awesome. And did you do anything in high school that prepared you for pharmacy school?
I don't think you could ever be prepared for pharmacy school, but I think for like being involved in medical science club, and I took honors classes, that was a really big thing. But I think it's more just, I guess, as I was going throughout high school, I knew what I was interested in, and just kind of figuring that out is really what helped me a lot.
Mm-hmm, mm-hmm. And I definitely agree with that. It seems like there's no more questions. So yes, and Pamela wrote, I'm an incoming P1 as well. I've been looking all over LinkedIn, but I've tried looking into medical writing, but I'm also a little non-traditional. Okay, so Amy, do you have any experience in medical writing, or do you know anybody who has gone down this route before?
And she's a P1.
She's an incoming P1.
P1. So I know there's a lot of smaller medical writing companies, if you look on LinkedIn to see those. And then the company that I have a rotation at in September is BGB Communications. And I know they take a lot of pharmacy students, and then a lot of pharmacy students do this rotation kind of if they decide not to do fellowships, that they hire from their students. I can look, and if I see anything, I could pass that on to you for medical writing. I think that's a really good area and good way to like kind of get your foot in the door. And I know with pharmacy school, we don't really have the experience with writing as much, but we understand the science background of it. So I can look, and if I'll see anything.
A great question, Pamela. Because medical writing is a route that a lot of pharmacy students take. We have until 9 p.m. If you have any more questions, you can continue asking them. And of course, Amy's information is right here. And we'll actually be providing Amy's internship flyer to you all after the session is done, because it's a great document for anyone who is looking to apply to a job. Even if it's not within the pharmaceutical industry, you can still use that flyer for any. Oh, Stephanie actually raised her hand. Yes, Stephanie, do you have a question?
Sorry, Amy, where do you prefer that I message you, through LinkedIn or like email?
Whatever works best for you.
Okay, sounds good. Thanks.
You're welcome.
Yeah, and Amy, if you want to share anything else with the participants, you can do that at this time as well.
I don't think I have anything else to share, but I will definitely look into other internships and send you a list that you could share with everyone of kind of ones that would be good starter ones that I find. And I know sometimes when you're looking, I really encourage a lot of the industry pharmacist organization members this year to look for internships. And for whatever reason, it seems that like a lot of people are hiring maybe in the beginning of the summer, and then you feel like if you don't get a summer internship, like it's kind of over. But for when I was applying last year at this time to OneSkin, there were so many things being posted. So it's really just kind of like in the timing of it. So if you look now and you feel really discouraged that there's nothing, look again in a few weeks and just keep checking on it. But I will definitely look and see if I could find a list of a few good ones that would be good for people who don't really have as much experience yet.
Of course, and thank you so much. That's so helpful that you are willing to, put in the effort for participants, as they go into the workforce. So it is currently 9 minutes away from 9 p.m. Central. And so if no one has any more questions for us right now, we can end the Zoom meeting, and our next meeting will be next Monday at 8 p.m. Central. And I wish you all the best of luck for the rest of the week. And thank you, Amy, so much for being a part of our presentation today.
You're welcome. Thank you for having me.
Okay. Bye, Amy. Bye, everyone.
Bye-bye. Thank you.